Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Tom.
And today we're talking about how to improve your mind-body muscle connection. And this is something that I think a lot of people question. Am I actually firing the right thing? I don't feel it. So let's dive in how you can improve that. So before we go into exactly the 5 components that we think really help to improve this mind-body connection, I also just have to say, when you are cued correctly, to understand what you're looking for and what you're feeling, it's going to make a world of a difference. And if you're looking for a place to help with that cueing and that visual feedback,
and a couple premier cueing coaches,
the Roll Into Hit program is now available for you to get. And this is something that Jill Miller, a fascial expert, and myself, a doctor of physical therapy, put together in order to help you ease into your body in a way that's going to help prep you for higher intensity work to build your strength, build your power, and reduce injury and improve recovery as you're doing this. So we have all the components in there. Click the link wherever that link will be. That's Roll Into Hit, and you won't want to miss this. I'm telling you, this is going to be such an epic way to help build that connection into your body. But again, if you haven't yet, please subscribe to our channel. We have so many more videos, not only on episodes like this, but on individual videos where I just break down movement really quickly for you, or about a pain, a diagnosis, whatever you're feeling in your body. And if you have more questions about something, please drop it in the comments so we know how to continue to help you.
Or different mind-body connection practices that you love. Let us know.
I love this topic in particular because one of my biggest pet peeves when I was working in the clinic would be people who come in and say, I don't have glutes, or they're asleep, they're not awake, I've been told they're inactive. And that's not a thing. You're walking, you're upright, you're moving, your glutes are working. We just need to improve how you're feeling those glutes during movement.
Our 5. So we're going to run through these and talk about each topic a little bit. The first one is touch, or mechanical stimulation, mechanical feedback.
This helps you to tell your brain where this muscle is and then how it is moving through space. It's actually going to help your proprioception when we bring some feedback to that area. So touch is so beneficial. And this is why, as physical therapists, we use touch within practice when we're seeing a client one-on-one, because we're helping to build in that mind-body connection prior to starting to move with the patient.
Yeah, the mechanical stimulation does so many different things. It, like you said, activates the proprioceptors, and we're going to say proprioception or proprioceptors a few times throughout this podcast, but those are really the nerves that are in our muscle tendons and ligaments that tell us where that joint is in space, right? Which means when I have my eyes closed, I can lift my hand up, I can touch my nose because I know where my hand, I know where my nose are, even when my eyes are closed. That's proprioception. I always think about knee wraps, right? The reason knee wraps feel so good, or people like to, I've had a knee surgery on my right. I've had a knee injury on my left. I like to actually work out with leggings or play basketball or pickleball with leggings on, because that compression around my knee helps me understand a little bit more what that knee's doing in space.
I mean, this is even why taping is so beneficial as well, which we have an episode that we did
on taping and on kinesio tape, or like the stretchy K tape people use. Yeah.
And like the main thing, you're going to have that touch stimulation going into that area. So you're going to help to increase that mind-body connection. So that, say it's taped on the shoulder in a certain way and you're going to play a sport or volleyball, it's going to help you to know where that shoulder is in space so that the whole shoulder complex and the shoulder girdle can work better together.
Another way to use touch that a lot of people probably use without knowing it is using different tools like foam rollers, or like our favorite tune-up fitness balls, or the Coregeous ball, because again, when you put pressure into that muscle, it helps you feel that muscle a little bit more to kind of prep or prime it for movement or activation.
And this is what we're doing with Roll Into Hit, which I'm so excited. Jill Miller is actually taking us through how to use her tools within their rolling kit. So there's different types of balls, different sizes and stuff, and we use them within the tissue to help to prep the tissue for better elastic feedback when we're going into those power moves in the high intensity work. And studies have shown that this type of rolling work, when you're working controlled into a muscle group or into a tendon, really helps to provide that prep work for the body to then go work out. Yeah. Better than stretching.
What I love about this roll into hip program is you use the tool, so you're going to relax and open up that muscle, but also prep and prime it for some more elastic or dynamic movement. And then you jump into the hit workout with Jen, where you're going to use that range of motion to your benefit, to go through the movements, to activate the muscles throughout that whole range of motion. Mm-hmm. So again, you're probably increasing range of motion, you're increasing the joint sense, the sense of the muscle, all around. Just an incredible program, an incredible concept to use tools. So there's a link down in the show notes.
The next area that we think is really really important to help improve that mind-body muscle connection is using your visual sense in order to help improve it. And this can easily be done by using a mirror.
Visual
just
feedback.
Looking at yourself in the mirror as you're doing a movement is going to tell you, oh, I'm actually kind of leaning to the side there, or I'm sticking my booty out a lot, or I'm doing something else funky.
Yeah, this is where I think you recommend a lot, like record yourself doing a movement. Like if you've ever been in any of Jen's challenges or programs before, just like record yourself doing this. Record yourself doing this self-assessment. You might notice things that you never knew you did before. Like you said, oh, my knee slightly goes this way, only on my right, but not on my left. Or my hip kind of waggles to one side when I do this squat or something.
I mean, that's even like one of the benefits of posting on Instagram is that I'm recording so much that I then watch it back and I'm like, oh, that looked a little interesting.
I would say I've looked more at my videos and like, man, that looks ugly. Like how could I redo this? And also when we talk about vision, it's a whole nother system of balance for us. You know, we have three systems of balance. We talked about proprioception. Vision altogether helps us balance. It helps you be able to see something, know which way's up. So hugely important that we train this visual system when we're talking about body sense or mind-body connection.
If you look at people who are working out, they're doing curls or something where you can visually see it in front. They're looking at it as it's
mostly
moving.
Just at their guns, how their big,
but
big their guns are.
It is a way of improving that mind-body connection. So now I'm working this muscle. I'm looking at it literally contract and lengthen as it's going through its full range of motion. You are going to help improve what's happening within that muscle.
There's a whole neurodynamic or neurologic concept called PNF, or proprioceptive neuromuscular feedback, facilitation or feedback, that requires you watching the arm or the hand or whatever while it's doing the movement. And we use this a lot when we work with patients who've had nerve injuries or strokes, and they're trying to regain motion or regain the sense of that joint, the ability to control that joint. So again, there's no reason healthy individuals or people who haven't had an injury can't take advantage of that principle.
Next one, we're really talking about
number 3,
switching up how you're doing that movement. So do something different.
Yeah, if you're looking for a different result, do something different. If you're looking to be able to move differently in a squat, make a change, and it could help you focus on a slightly different aspect of that squat.
So let's give an example. I think one of the ways, like if someone is saying, you know, you need to turn on your core, you need to brace more within a squat. I think one of the easiest ways to start to do that, you can, rather than doing a back squat, you can automatically do a goblet squat or a front squat, bring the weight in front of you. You're going to be having to use the front of your aspect in that front of the core a little bit more. Or we can even just turn that squat all the way horizontally. So now I'm on all fours and then I lift my knees and I squat back. Well, in order to prevent my pelvis from moving or my spine from moving, I'm going to use that entire core from my shoulders all the way down to my hips in order to start to stabilize. And that's going to teach me, okay, here's what it feels like in this horizontal position. Now let me translate that into vertical position while I'm squatting.
Similar with talking about the squat, you know, we talk about hip dominance versus knee dominance, or, you know, being able to use the quads more versus the hips more. So one way you can play with this is elevate the heels slightly. That's going to cause your knees to go a little further forward, keeping your trunk a little more upright. You're going to have to activate the quads, but again, then pushing through the heels, you're going to be able to feel those glutes as you use them with the quads to raise up, versus if you put something under your toes, you're going to notice that you need to use more of a hinge pattern where the hips are going to go back. You're going to be primarily doing more of the movement with hip flexion rather than knee flexion. So you're going to have a slightly straighter leg during it, and it's going to look more like a deadlift.
You might feel a little bit more in your back and your glutes, you know? So just changing how we're positioning our body. Again, doing something different. If I feel like I'm only feeling quads, what can I do that can make us feel a little different? And we actually have a podcast, I believe, too, on all these different squat patterns. And if you're having back injury,
three of them primarily.
Yeah, if you're having a little bit more back pain or knee pain, like here's the type of squat that you should be doing. So we do have a podcast where we talk about that. But I mean, this is for push-up. If a push-up isn't feeling good, how can we do something different? We can elevate the surface. And if I elevate the surface, well, then I can help to turn on muscles without having to really control my core as much. Maybe my core is limited or my shoulders are limited. So now I can actually feel my arms and my chest working because I'm taking out a component that adds a lot more force.
That actually brings up a great point where do something different doesn't necessarily just mean change the movement. It might mean like do a slightly easier progression of it so that you're not forcing yourself to try and do a movement that you're not prepared for and then compensating. Push-up was a great example. Maybe doing an overhead press with dumbbells or a straight bar is difficult because of shoulder or upper back mobility. So we should try something different where we're doing like a landmine press where you don't have to go into as full of shoulder flexion. Moving into number 4, one of our favorite things is go barefoot.
This is just going to help to bring that sense of what's happening from the ground up and give you so much more feedback because you're feeling the ground underneath you. Typically when we have shoes, especially like running shoes and we're trying to squat in them, we're actually more so utilizing our balance system because their shoes have so much squish and usually it's a higher lift into the heel. So now it's pushing forward onto your toes, but you're trying not to just use into your toes. So you're like trying to balance and support your body. And then all of a sudden I feel more quads or I don't feel this. I don't feel my glutes, Well, take off your shoes.
Yeah. Taking off your shoes can do. Our feet are one of the most places that have like dense sensory neurons that help us balance. We talked about proprioception. If we can actually feel the ground beneath us, makes a huge difference in how we can balance and then therefore how we can move. For example, try doing a squat barefoot and then put 2 pillows under your feet and then try doing a squat. And it's going to feel significantly different. And that's not exactly the same as putting a pair of shoes on, but if you have a thick bottom, if the toes are restricted at all, if there's arch support that your foot normally doesn't have when you're barefoot, again, going barefoot is going to help you feel the ground, take advantage of your sensory nervous system. And for some people, this might feel fairly difficult. If you haven't gone barefoot or done movement or exercise barefoot in a long time, in decades, if you've always been in shoes, if you wear slippers inside, being barefoot might actually feel weird because in a sense, we've been training our feet out of needing to use those sensory neurons, those muscles that our feet are built with to move for themselves as much. If you don't feel comfortable in socks or you're at a gym that just doesn't allow that, get a pair of barefoot shoes.
Yep, that is one of the best ways.
It's all we've worn for as long as we started wearing Vivo barefoot shoes.
Oh my God, it's everything.
We work out in them, walk in them, hike in them. We wear water Vivos. We have dress Vivos. And I really wouldn't want to put my feet in anything else because it has the space that you need. It allows your foot to move for itself. Wearing Vivo barefoot shoes for 6 months alone for the majority of the time increases your foot strength up to 60%, which is huge. Incredible. So just to see that type of change in 6 months alone, especially if you're hesitant about starting, it's like, okay, in just 6 months, you can feel that big of a difference in your foot strength. And it will make that big of a difference in your movement and how you feel walking barefoot. And if you do want to get a pair of Vivos, we have a special podcast code that we give to our listeners only. It's code TOB, like the optimal body, and you get 15% off your entire order. So check them out. They have a 100-day risk-free trial, so you can always send them back if you don't feel like you got the right size or the right pair, but you won't be disappointed.
And the last point that we think is really important when it comes to improving your mind-body connection is really to just start to move. Stop overanalyzing, stop restricting yourself, and just move.
A lot of people who are hypermobile don't feel like they have good body sense or don't feel like they can control their joints. Their knees might always lock out or they're always kind of resting into their hips and they'll get hip pain. And one of the things that we've heard from those people and from the research is that strength training is going to be something that really helps you feel confident through that full range of motion.
So ditch those little 2 or 3 pound weights and actually add some load to your body. When we load the body, we're changing the way that we're using that movement as well. A lot of people will do some presses overhead or some punches, and then all of a sudden you get a bigger weight to them. And it's going to change your movement of how you're moving that weight now, because now you're like, oh, my body feels something different. I have to control my core. I have to press in a little bit more slowly, or I have to do things with a little bit more control. So when we start to load the body, we're going to really have to take a look at the control and what our body is doing. And so it kind of forces you to have a little bit more of that mind-body connection when we actually put more load, more external load onto the system.
And then it helps prepare us for those functional activities that we might encounter every day, where, like you said, if you just have a 2 or 3 pound weight and you're punching in there, you can do that in any direction. But then all of a sudden you go to pick up a 10-pound pail or a 10-pound bag of groceries, you can't quite move it the same you can that 2-pound weight. And if you haven't trained that, you might put that shoulder or that arm at risk of injury because you're used to just throwing those weights around everywhere, where if you train with 10, 15, 20-pound weights, your body's going to know the efficient movement pattern to be able to, like you said, control through all the segments from the core to the shoulder blade up through the shoulder to do that effectively and safely. Same with picking up something from the ground. If all of a sudden you go to help someone move a couch or move a table, your body's going to be more prepared to be able to take that, whatever it is, 20, 30, 40-pound load. So there you go, our 5 pointers for growing that muscle body-mind connection. Are there any things that you do that you want us to know about? Comment below. Are there any questions you have on the points that we brought up? Let us know. Remember to hit that subscribe and notification bell, and we'll see you next time.